be anxious for sedation or any kind of dental procedure, to be honest, but there are times where we just have to kind of put ourselves in the child's shoes. As parents, of course, we want our child to be able to tolerate, a dental procedure without sedation or any kind of procedure. But, I always try to remember what it would be like for myself to go through the procedure. And then you have to, think about yourself as a 5 or 4-year-old person going through that procedure. Dental procedures, are long. Unfortunately, you have to be completely still for about 30 minutes with your mouth open. I know even for an adult, that's hard to do. So, sedation sometimes is a necessary part of what we do, just like it is in the medical field. So you can imagine, even right now, how many people are doing sedation or asleep, getting a procedure done right at the second in San Diego? A lot. So it is something that's routine. It is something that's done quite a bit and is the standard of care in pediatric dentistry. But if we see any kind of risk factors where we don't think a child is an optimal candidate for doing a procedure in the office, we usually refer those patients out to Rady Children's Hospital and get their treatment managed as safely and comfortably as possible. I can remember one child particularly who had such a bad dental infection and so much pain that he was scared to let anybody look at him, let alone come in the room. And anytime anybody touched his tooth, he actually started gagging. That's how much pain he was in. So we couldn't barely get him into the chair, but I tried to do one thing a little bit differently and let him breathe about 10 breaths of laughing gas through his nose, which is a different, strawberry flavored or grape flavored. After about 10 breaths, this kid was smiling. He was in a good mood. And he actually just walked into the chair on his own. He let me do whatever I needed to do. I numbed him, completely removed the tooth without a peep. And these are the kind of things that are just absolutely not possible without the use of laughing gas or some type of sedation for children. Nitrous oxide, which is laughing gas, has been used for almost 150 years in dentistry. So something that's really safe, really effective, and is so helpful for children in these scenarios. So, we're thankful to be able to have all these tools at our arsenal and be able to help any kid who really needs it. For children with special healthcare needs or extreme dental anxiety, IV sedation opens a door for treatment for these children that, they would have never been able to have otherwise. For instance, IV sedation and anesthesia is used to remove wisdom teeth pretty much on a daily basis for oral surgeons. And for pediatric dentists, it allows us to do good quality work without having any interference of patient movement. Patient movement during dental treatment, is expected, but in longer procedures or procedures that require a child to be perfectly still, it allows us to complete the work safely, comfortably for the child, and again, get good quality work done. We work with a board certified anesthesiologist to provide our anesthesia for children. The reason we do this is the way that it's done in a hospital setting when any child has a surgery in the hospital from tonsillectomy or something minor like ear tubes done. But this is basically the best way we can perform a sedation for a child, and it's also the safest way. You have a dedicated board certified specialist monitoring, administering the anesthesia for the child, and also monitoring the child when they are recovering and waking up. This is a lot safer than the dentist doing the treatment and administering the sedation and monitoring the child. There's just too many, things to focus on. And so we prefer to have things done the best possible way, which is having a dedicated board certified specialist doing the sedation for your children. The number one question I receive from parents in Sorrento Valley regarding sedation is, bottom line, is it safe? So the way we would determine if your child is a candidate for doing sedation in office is we review their dental needs, We also review their health history. We look at their airway, and we also have a detailed checklist that we go through as pediatric dentists to determine if they even qualify for the sedation. Once we have done our assessment, our anesthesiologist also reviews all that information. And if there's any other detailed questions they need to ask or specifics on the medical history, we'll contact the parent, get that information as well. We also review everything again and assess the child again on the day of the procedure to make sure that they're 100% safe and qualified to go through with the sedation. So, in a sense, you have two different board certified specialists evaluating your child, and they're evaluated three times separately before the sedation even happens. So, we do a pretty rigorous checklist to see if the child is safe to be seen in office. And if they are, then we proceed with scheduling the sedation. If there's any risk that, we see for this child where it may not be optimal conditions for them to do it in this office, we'll usually refer them to a hospital sedation setting to get their treatment done. The way that we determine what type of sedation is best for the child is based off of a number of different factors. One of the considerations is the amount of dental needs that they have. A child who has one appointment of treatment, may be able to tolerate a short appointment with something like laughing gas. That same child, even if they do have one appointment, if they come in with extreme anxiety, not able to sit in the chair, not able to take x-rays, we usually have to do some type of more extensive sedation to complete their treatment. Again, a child who has multiple sides of work, very young, anxious, and not able to stay still for their appointment, that's where we consider other modalities outside of laughing gas to complete their sedation and their dental work.